You could get hit by a car, spend 3 hours in an emergency room getting basic treatment, and walk away owing more money than a used car costs. This has actually happened to real people, documented with the bills to prove it. And the strange part is not that it happens. The strange part is that in almost every other wealthy country on earth, it simply does not. Everyone knows American healthcare is expensive. That is not the interesting part of this story. The interesting part is why, specifically, because the reason is not what most people assume, and once you see the actual mechanism, you cannot unsee it in every medical bill you get for the rest of your life. Here is the number that should stop you. The United States spends roughly twice as much per person on healthcare as the average wealthy country, according to data tracked by the OECD year after year. Not slightly more, roughly double. And here is the part that makes no sense on the surface. Americans do not live longer. They do not have better health outcomes on most major measures. In several categories, including life expectancy and infant mortality, the US ranks worse than countries spending half as much per person. So the extra money is not obviously buying extra health, which raises the real question. Where is it actually going? The most common explanation people reach for is that American doctors are overpaid, or that Americans are simply sicker, or that malpractice lawsuits drive up costs. Each of these plays a small role. None of them comes close to explaining a gap this large. Physician salaries account for roughly 8% of total healthcare spending. Malpractice costs, including defensive medicine, are estimated at a similarly small slice. These are real factors. They are not the main story. The main story is pricing itself, and specifically, the complete absence of a single, transparent price for anything in American medicine. Here is something almost nobody outside the industry realizes. The exact same MRI scan, at the exact same hospital, on the exact same machine, can have a dozen different prices depending entirely on which insurance company is paying for it, or whether you are uninsured and paying cash. Hospitals negotiate secret, individual rates with each insurance company. These negotiated rates were legally confidential until relatively recently, meaning no patient, and often no doctor, actually knew what anything cost until the bill arrived weeks later. In 2021, new federal rules forced hospitals to publish their actual prices. Researchers who dug through the data found individual hospitals charging 4, 5, sometimes 10 times more for the identical procedure, depending on which insurer was billed. There is no other major consumer market in America that functions this way. You know the price of a car before you buy it. You know the price of a plane ticket before you book it. In healthcare, you frequently do not know the price of anything until after you have already received it, which means the entire normal function of a market, comparing prices, choosing the better deal, simply does not exist for most medical care. Now, here is where it gets structural, not just messy. Every other wealthy country either negotiates drug and procedure prices as one unified national buyer or heavily regulates what providers are allowed to charge. The United States, uniquely among wealthy nations, largely does neither. Medicare, the government program covering seniors, is even legally prohibited from negotiating drug prices directly with pharmaceutical companies for most of its history. A restriction that was only partially lifted starting in 2023 for a small list of drugs. Compare that to countries like Germany or the UK, where a national health system negotiates as one massive buyer and simply refuses to pay above a certain price. Pharmaceutical companies, facing a market of one, have no choice but to agree. In America, thousands of separate insurance companies negotiate separately, individually, with far less leverage than one unified national system would have. This is why the same drug, made by the same company, in the same factory, can cost 3 or 4 times more in the United States than in Canada or Germany. It is not a manufacturing cost difference. It is a negotiating power difference, baked directly into how the system is structured. Now let's talk about the part that actually shows up in your mailbox: surprise billing. You do everything right. You check that your hospital is in your insurance network. You have surgery. Weeks later, a bill arrives from a doctor you never chose, an anesthesiologist, a radiologist, someone who happened to be in the room but was not employed by the hospital and was not in your insurance network. This used to be one of the most common sources of medical bankruptcy in the country. Congress passed the No Surprises Act in 2022, which closed a meaningful chunk of this specific loophole for emergency care and certain scheduled procedures. It was a real, documented improvement. It did not fix the underlying pricing opacity that makes the whole system function this way in the first place. Here is the piece that connects all of this back to your actual wallet right now, whether you are healthy or not. Roughly 100 million Americans currently carry medical debt, according to research from KFF, one of the most cited health policy research organizations in the country. Medical debt remains one of the leading causes of personal bankruptcy in the United States, a distinction almost no other wealthy country shares, because almost no other wealthy country allows a single hospital stay to financially ruin an otherwise financially stable person. And this is not only an uninsured person's problem. A large share of people carrying medical debt had insurance at the time they got sick. High deductibles, meaning the amount you must pay out of pocket before insurance starts covering anything, have risen sharply over the past 2 decades. The average deductible for employer-provided insurance has more than tripled since 2006. Having insurance no longer means being protected from a devastating bill. It increasingly means being protected from the very worst version of a devastating bill. So what can you actually do with this information beyond feeling angry about it, which is a completely reasonable reaction? First, prices are negotiable more often than people realize, especially for anyone uninsured or facing a large bill. Hospitals frequently have financial assistance programs, and simply asking for an itemized bill and questioning charges has been shown repeatedly in journalism investigations to reduce what people ultimately owe. Second, that price transparency data hospitals were forced to publish in 2021 is publicly searchable. And several non-profit tools let you compare prices for common procedures at hospitals near you before you schedule anything non-emergency. Third, understanding your specific deductible and out-of-pocket maximum before you need care, not after, changes how you make decisions about where and when to seek treatment. None of this fixes the structural problem. One-person comparison shopping cannot fix a system built on secrecy and fragmented negotiating power. But knowing exactly why the bill is the size it is changes something. It stops being a mystery you feel powerless against and starts being a system with specific, documented mechanics. Mechanics that occasionally, with the right questions asked at the right moment, can actually be pushed back against. The real question this leaves you with is simple. The next time you get a medical bill, are you going to accept the number on the page as fixed, the way you might with a price tag at a store? Or are you going to remember that in American healthcare, that number was very likely negotiable the entire time, and almost nobody ever told you?